It's up to the legislature, though, to actually pass the budget by June 15th. That's the constitutional deadline. So there's the budget proposal by the governor in January, and then the legislature has a body called the Legislative Analyst Office, the LAO. And they are a nonpartisan group that works for the legislature. So when the governor says this is what we think the budget is going to be this year in January, the LAO says, okay, well, legislature, I work for you, and I'm going to tell you this is what I think the budget is. And then the governor, and then the legislature and the governor enter into negotiations over this time, and we have legislative hearings until the June 15th deadline. So I just wanted to give you that structure before we jump in. So what does the governor say the budget is? Well, the governor proposes to spend $248.3 billion of general fund. Now, general fund means the state's general fund, right? This is like state money. It projects there to be 42.3 billion in additional tax revenue coming in compared to the last time we passed the budget, which was last June, right? So back then they projected what they thought the tax revenues were going to be, and this is $42.3 more than we thought we were going to get. So a gangbuster year. We'll kind of get into why did we have such a gangbuster bill in just a bit, but $42.3 billion in more money. Sounds like a great thing, right? Well, let's not get too excited. Maintains previous state level cuts in the previous budget. So there were a number of cuts that they made in the previous budget last year to balance the budget. So it maintains those cuts, but it doesn't create more cuts. So he doesn't propose to make more cuts in the healthcare space. So we had a lot of Medi-Cal cuts in the previous budget last year. He maintains those cuts, but he's not proposing so far to have additional cuts to the Medi-Cal space and other healthcare items. It does address according to the governor, it addresses a projected deficit. He believes that this budget proposal that he's created will close the budget deficit, and it still has money in reserves. You all may recall something called the rainy day fund. That's essentially the state savings account for like if things get bad. And he maintains $23 billion with his budget proposal in January in the rainy day fund. So in our state savings account to keep going into the next years in case we get more problems. It does not propose any new investments in healthcare, and it doesn't really propose to address the significant cuts that we will get to federal funds to California as a result of HR 1. The big, beautiful bill made a lot of cuts to healthcare, in particular Medicaid, which we call Medi-Cal in California. And it doesn't really address in the January budget those cuts. And those cuts are going to be just to Medi-Cal alone will result in a loss of $1.1 billion every year to Medi-Cal. And he doesn't really address how to fill that gap in his budget. Next slide. And this is kind of what the budget looks like. If you looked at it as a piece of pie, where is healthcare spending? Well, you'll see that little red piece of the pie at 27%. So that's more than one out of every $4. So one out of every four California dollars, those are dollars that come from our tax revenue. One out of every $4 is spent specifically on healthcare in California. The vast majority of that is to the Department of Healthcare Services for the Medi-Cal program. So you can see it's a very significant portion of the budget. So when we're going to lose $1.1 billion in federal funding every year, and we're already spending one out of $4 on healthcare in California, you can see how that's going to impact us in the future. Next slide, please. So do you remember me talking about the Legislative Analyst Office, the LAO? Now, what do they say about the governor's budget? how can I put this nicely? They kind of say baloney. They really don't believe that the governor's projected revenues are going to be as strong as the governor says they're going to be. Now, why is that? The reason we've had such a great tax revenue collection so far is not necessarily because the economy's doing well. I think many of us know many of us are struggling, right? We know people who are struggling. We see people who are struggling. Our own households may be struggling, right? Because everything's getting more expensive. Healthcare premiums are going up. The cost of food is going up. So, with all of this pressure, how can we possibly be bringing in more money than ever into the state coffers? Well, it's because of the AI stock tech boom. AI is driving the economy right now. And in California, where AI was built, that means the revenues are going through the roof. So even though many people feel like the economy is not doing well, really the AI tech economy is creating a huge boom for California. And so the revenue increases are largely all coming from that AI stock boom. Now, the reason why the Legislative Analyst's Office does not agree with the governor's projected revenues for the rest of the year is because the Legislative Analyst's Office believes that the AI tech boom is going to bust. We have a bubble, they believe it's going to burst. And they talk about the dot-com bust of the past and the Great Recession during the financial crisis when we saw the housing market grow and grow and grow, and then all of a sudden it bust, right? And then the economy collapsed. We saw that with the dot-com as well. They are analyzing the stocks and they're comparing it to historical records of how stocks or other things in the economy have grown and grown. And they believe, based on their analysis, we are very close to a bust. And that is why they don't believe the governor's projected revenue. In fact, the governor declared that there was only a $3 billion deficit that he needs to close for this year. And the Legislative Analyst's Office said in November in their report, we actually think it's an $18 billion deficit that you need to close. Now that's a huge difference, right? They're predicting that the deficit that this year we need to close is 6 times greater than what the governor says we need to close, right? So they are urging, the LAO is urging the legislature not to believe the governor's budget proposal based on his projected revenues and instead try to close a much bigger gap. Now, here's the most important thing that the LAO has said so far on this item. Previously, whenever we've had budget deficits, it was cyclical, right? Because the reason we had the budget deficit is because the economy took a tank, right? And then that meant less money and tax revenue being collected by the state. So it was cyclical. And it was cyclical because the economy is cyclical, right? Sometimes we do really well, sometimes we don't. The LAO is saying we now no longer have a cyclical deficit. Instead, they say we have a structural deficit, and that's very damaging. The structure, it's not because we're not bringing in enough money. The structure of our budget spends so much money that even though we are bringing in more money than ever, we still have budget deficits. And in fact, we've had revenue growth over the past couple of years, and we still have to address budget deficits. And that's why the LAO is urging the legislature to really start considering cuts, major cuts that can be addressed in the next few years. So they're starting to think about you need to look at your spending. And if you do little moderate cuts here and there, over the next couple of years, you can hopefully avoid catastrophic cuts in the future. Because if you ignore this problem, we think you're going to have catastrophic cuts in the future. I am going to, I think I saw a hand raised, Lynn, so I can pause just in case you had any questions about what I just talked about.
Yeah, was there hands raised with the question, or I don't see any
Something in
questions
the
in the
chat.
chat.
Okay, okay. Then I will move on. And then just drop a question in the chat if I say something that you really want to go over a bit more. So let's talk about the Medi-Cal budget in particular. And this is where it's very concerning because of HR1's $1.1 billion in fewer federal funds coming into California, right? Right now, the governor proposes to provide $196.7 billion in total funds for the Medi-Cal program. 46.4 billion is from the general fund. That means it's from state funds. He's projecting that the enrollment is going to include 14.5 million members and that it's going to decrease over the next year to 14 million in 26 and 27. That is a decrease from what was a year ago, 15 billion. So you can see that our numbers are dropping. The managed care organization tax, I want to talk about that really quickly. It sounds like a very strange concept, but essentially in California, much of the funding for the Medi-Cal program has relied on a tax that the state puts on managed care organizations that have a high enrollment of Medi-Cal beneficiaries. It's kind of like you service a lot of these people, so you're getting tax dollars. So we're going to tax you back in order to keep funding the program. That's kind of the way to think about it. But HR1 changed the way states can continue to collect taxes from managed care organizations. And essentially, the way California does it is now not compliant with HR1. And we have to change the way we organize the managed care organization tax. And we have to do that by June because it expires in June. The problem is I don't know if the state can do that by June. And so they'll most likely need a 6-month extension from the federal government. If they don't get that extension, then California will lose an upwards of $1.1 billion in revenue from the managed care organization tax. So we're already looking at a billion, 1.1 billion in loss of federal funding because of HR1. But also, if we don't reorganize this managed care organization tax and get an extension on when we can submit that this year, in the next 6 months, after June, we will lose another $1.1 billion. And the governor's office does not include that as a possibility when he created the January budget. So that's another weakness. So one of our major funding sources for Medi-Cal could be disappearing this year. What does all that mean? It means that if we don't take some of these revenues seriously, then we could see possibly very devastating Medi-Cal cuts in the future. I don't think we're going to see them this year. It is the 2026 midterms, and I just don't think, I think the governor and the legislature will try to avoid as many devastating cuts as they can. But what that means is that they are creating a situation in the future that will have very large deficits. We're talking the estimates are between 20 to 35 billion a year for the next few years. That's a deficit. And so that's when we're looking at when the Medi-Cal program could be in serious trouble. And I anticipate that being next year. I think it's possible that we can avoid serious cuts this year, but I don't think it's possible in the Medi-Cal program to avoid those cuts in the next few years. It's just looking if that way. However, I will say this, economies always change and things always surprise us. So we could not only see the AI tech bubble not burst, but continue to grow. And we could also see the rest of the economy rebound over the next few years. And that would mean that the projected revenues wouldn't be as bad as being anticipated by the Legislative Analyst's Office. I'm going to stop right there and see if there are any questions about any of the things that I talked about.
So, any questions specifically about the budget or the impacts that we're anticipating for Medi-Cal? We are going to get a little bit into CCS and GHPP in a moment. Okay. So, just a couple of things, and I think we have already said this briefly, but wanted to remind everyone, because I do know that this does not sound like a rosy picture, right? But nothing that we've talked about so far is like final. Like these aren't a final deal, right? So this is the governor's January proposal. There is going to be what we call the May revise, which the governor will put out in the middle of May after more of the tax returns have been filed and they have a little bit better sense of like what the revenues are looking like coming in. And as we always say throughout this process, our voices are really important. The reality is that, the budget situation is not good. And so there probably will have to be cuts and or increases to revenue in order to fund the programs that we care about. But there are choices that they're going to be making in terms of how they're going to structure those cuts and what, other programs might be cut instead of these programs, et cetera. And so it's really, really important this year more than ever that we are really active in sharing our concerns and speaking out to our legislators about all of these issues. So kind of building off of what Cher was talking about, just some reminders. I know some folks that are on this call probably have Medi-Cal yourselves, or you work with patients, or you have friends or family members that are impacted by these changes. So a couple of quick comments just for folks to keep in mind. The Medi-Cal redeterminations resumed, and that was a while ago now, right? During COVID, people didn't have to renew their Medi-Cal. They just kind of continuously were on it, and the redeterminations, which is what the technical term that they use for the renewals, stopped. But those have resumed again, and so make sure that Medi-Cal has your updated contact information and that anything you get, whether it's from Medi-Cal, whether it's from your health plan, most people are on Medi-Cal managed care plans, meaning that a lot of the communication they receive might come from the company, the Medi-Cal managed care company, which could be Kaiser or it could be Blue Shield or, United Healthcare, right? Or like a county operated health plan. So they might have all kinds of different names, even if you are still covered by Medi-Cal. So make sure that whenever you get information, you respond timely and submit whatever that they're asking for. And if you need assistance with that, you should never have to. This is the next thing, right? Um, sometimes there are, entities out there that try to take advantage of people's concerns, right? You should never cost you anything to apply for Medi-Cal or CCS or GHPP or to renew your member or renew your enrollment in any of those programs. No one should be charging you for that. And so if you need assistance, you can contact your hemophilia treatment center. If you're seen at one of those treatment centers, your special care center, oftentimes your providers can help walk you through that, or you can reach out to us when reach out to us as well, and we can assist you with that paperwork. And then a specific note for those that may have an unsatisfactory immigration status. Enrollment into full scope Medi-Cal for those folks has ended. And so, but they have not indicated that they're going to actively remove people who have already enrolled. And so, if you have that Medi-Cal in place, it is especially important for those populations that you do not let your Medi-Cal lapse. Okay, because if you let it lapse, you may not be able to get it back. And so, in particular, for those populations, but for everyone, right? We never want to have a gap in coverage because that can be really detrimental to your access to healthcare. Okay. So, and related to that, and I know that there have been a couple of questions in the chat about this. So, the Genetically Handicapped Persons Program, or GHPP, provides services for those that are 21 and older, while CCS serves those up to age 21. At this point, we do not see cuts to those programs in the governor's budget. That does not mean that we don't have concerns that that could be an issue going forward. But at this point, they are funded, and and those are really important options for people, particularly GHPP. If you are at risk for losing Medi-Cal, or if you have already, I know there was a comment, the premium increases in covered California have already hit some folks. If those are pricing you out of healthcare and you have a bleeding disorder or another condition that GHPP covers, that is a great option because it's not gonna, some of the things that are impacting Medi-Cal as of right now are not impacting GHPP. And so you may want to go ahead and get enrolled in GHPP. The other note that I would make is that for those that are looking at Covered California, enrollment for Covered California ends January 31st. So you only have like 48 hours or whatever that is left to get that enrollment in. I would get on that ASAP if that is what you need in order to stay covered. And because there could very also be a rush of people trying to get on that website with the enrollment period ending. And they have had issues in the past with that crashing. So I would not wait until, 10 o'clock on the 31st to be trying to submit that information. If you have to do that, please get on that. And remember, you can always reach out to us if you need kind of personal assistance navigating through these options. Okay. So let me pause there. Are there any questions on sort of Medi-Cal, CCS, GHPP, and how that is, impacting people's coverage in the immediate? Feel free to raise your hand, unmute, put it in the chat. Okay. Well, feel free to pop those into the chat if you had a question and you just didn't get a chance to say it, or you can shoot us an email. Um, excuse me. Oh, I do see one popped in. So, my daughter's 22. Besides Covered California, what other program can she apply for? So, um, at age 22, Medi-Cal or GHPP, depending on what your diagnosis is, would be your primary options besides Covered California. So, not every, I mean, it depends on, you mentioned that she needs medication. If she has a bleeding disorder, then GHPP would be a great option for her to apply for. Um, and there are some other genetic disorders that are covered. Yeah, factor seven would be covered by GHPP. So I would definitely look into GHPP for her. So kind of moving topics slightly. we wanted to kind of go over a few other things that are on the horizon this year. This year, we're really focused on expanding our efforts to build a coalition of rare disease advocates along with other rare disease organizations and patients. And so, if you want more information about how to get involved with that effort, we have a new website specifically for the Rare Disease Access Coalition, which is calraredisease.org. So you can check that out. And we will have 3 meetings this year that will be like policy discussions that the Rare Disease Access Coalition will host, as well as monthly calls for patients and patient advocates that want to be more involved in our efforts here in California. And then other ways that you can get involved. So we have our webinar series that this is the first one that we're kicking off for our 2026 series this year. And then we also have our Advocacy and Access Ambassadors program that meets every other month to be more involved in advocacy efforts. Our first meeting will be on Monday of next week. And so if you are interested in joining, you can go onto our website and fill out that application. Um, and then we have Future Leaders and Legislative Day coming up. Future Leaders is for high school students who are rare disease patients and or have an immediate family member who's a rare disease patient who are interested in learning more about advocacy and then participating in our future or our excuse me our legislative day, which this program will run March 21st through the 24th, with legislative day being Monday, March 23rd. So those registration deadlines are coming up. This year, I've said it before, more than ever, we need your voices at the Capitol to be bringing these issues to our legislators. So we are just hoping for a huge turnout this year. Registration is running ahead of schedule, and our spots for future leaders are filling up quickly. But we would encourage you to get those applications in, share them with your friends, family, allies. Folks don't have to have a rare disease or a bleeding disorder in order to participate. Everybody who wants to advocate on behalf of our patients is welcome to join us. And then I mentioned the Rare Disease Access Coalition. Our first meeting for the year is going to be February 26th. And then make sure that you're signed up, that you get our e-blasts and our newsletter so that you can be made aware of opportunities to comment on legislation and events. So, we also wanted to talk a little bit about our advocacy priorities for the year. There are going to be a big focus is going to be protecting Medi-Cal and CCS and GHPP, which we've already spent quite a bit of time chatting about. We also are aware that the insurance commissioner here in California is looking to work with the legislature and introduce a bill that would ban the practice of copay accumulator adjusters. So that's that patient assistance, those copay assistance programs that we talked about. We will be actively involved in that. And then, every year we engage in activities in March, Bleeding Disorders Awareness Month, to raise awareness. So those are a few of the items on our radar, although as bills get introduced, we're anticipating that there will probably be some things on prior authorization and other patient-focused issues that we will look at and support and oppose as necessary this year. And briefly, just as far as our upcoming webinars, we don't have all the topics lined out for the rest of the year, although there will be a lot, I think, surrounding Medi-Cal and just access to insurance and access to coverage, given everything going on this year. But we will have a focus in February on preparing for advocacy days by kind of really looking at how you can tell your story effectively. And then March is always our webinar prior to legislative days where we kind of go over the issues and get everyone ready to participate. And that's obviously a big focus for those that are going to attend legislative day in person, but we encourage everyone to participate in that webinar because even if you can't come in person to legislative day, you can still kind of use that training and then reach out to your legislator via email or a phone call in order to share your story and your support of the issues that we'll be presenting. So, we're just a little bit over time at this point. I just want to remind everyone that you are your best advocate. With everything going on in the world right now, I know that it can feel a little bit overwhelming and it can feel a little bit kind of helpless. But there is still an opportunity to speak up and to make your voice heard and to influence the outcome of how all of these things are going to play out in the coming weeks and months. And so we encourage you to be part of that. And I know for me, when I get kind of in that frustrated or concerned, anxious place, being able to get out and advocate, really helps lift my spirits because I know I'm doing something active, to make a difference and to help someone and as well as myself. So I want to thank our sponsors for contributing to our ability to be able to provide this webinar series. And I'm going to leave this slide up with the contact information in case you have sort of individual questions that you want to reach out to us with. But that will conclude our content for this evening. I will stay on here for just a minute if anyone has any follow-up questions that they didn't get a chance to ask. Thanks, Cher.
Thank you, everyone.
See any questions jumping in. So thanks, everyone. Have a good evening.